It is 9:30, so we're going to go ahead and get started. Hopefully more people will be able to get on as we get started this morning. I know that my staff, for some reason, our link in our calendar isn't working. But if there's anybody new to our collaborator, if you haven't seen us in a while, if you want to introduce yourselves and tell us which organization you're with.
Yeah, hi, my name's Lou Gross. I'm the PIO for Kern Behavioral Health and Recovery Services, and I've been working with Claudia for quite a long time to have some representatives from our department here just to talk about our services that we provide the county, and more specifically, to some of the partners in Fraser Park and the area up there. So excited to be here, and I'm joined today by our new director, Allison Burrows, our deputy director, Robin Taylor, and one of our administrators, Heather Hornibrook.
Oh, great. Thank you guys all for joining us, and we look forward to hearing more about you and learning about the services you offer. Anybody else that hasn't been here in a while or is new, do you want to introduce yourself?
Hi, my name is Steve. I'm with the Kern County Public Health Department. I'm a health education assistant. I just started with them at the beginning of January, so I'm excited to work with you guys to help the community.
Thank you. All right. Now everybody's getting logged in. Here we go. Anybody else want to introduce yourselves or tell us, which organization you're with before we jump in this morning? Trying to give people a few more minutes to log in. I know it's a crazy Thursday. What's the weather like in Bakersfield for you that are down there?
It's a cloudy, drizzly kind of day.
Oh, see, we finally have sun.
Only in Fraser.
Only in, I know. I left home and it was very cloudy in Lebec. And then poor Corey leaves Fraser where she lives to go down to the clouds.
So I haven't been here for a while. Lindsay Call, representing First Five Kern. I'm gonna present a little bit in a bit, but it's good to see everyone. I've missed being here, so I'm happy to be here.
Thank you, Lindsay. Yeah, for those of you that don't know, Lindsay was actually the executive director of the Family Resource Center here in Fraser Park for many years. She served on the board. She, put over a decade of her life into here until she found greener pastures at First Five.
I wouldn't describe it that
way. Commute. The commute's much better, right? And now their new office, if anybody doesn't know, First Five has moved. So now they're right there in California, which is very close to a Panera, which I've heard a lot of the staff at First Five like Panera. So location's everything. So, but anybody else new that would like to, or hasn't been in a while and would like to reintroduce yourselves?
Hi, good morning, everyone, and thanks for having me here today. My name is Doris Reyes. I'm a health educator with Kern County Public Health Department. I went into the in-person meeting that we had sometime last year. I think it was September, October. I loved it, and so I was trying to get into this meeting, and so I'm just happy that I was finally able to join the meeting to see what kind of information is provided, and for me to take notes and learn more about the mountain communities. Thank you.
Well, thank you for joining us. Okay. I know that, let's see, is Claudia on yet? Because I know she's having trouble from her internet at home. I don't see Claudia on, so I guess we'll jump right in. Claudia was going to kind of run some of the meeting for me, but I'll jump in and we'll introduce, I believe it's Allison that's going to speak for us this morning, or is that changed? I know there's been big changes there at behavioral health.
No, I am the change.
Okay.
So. No, so thank you for having us. Yeah, I'm Allison Burrows. I'm the director for the Behavioral Health Department. Received a permanent appointment last week, but had been interim for a couple of months. And prior to that, our director, Stacy Kuahara, I think she had been scheduled but unable to make it to a previous meeting. So she's now with the CAO's office. So we've had a little bit of leadership change over here with our department. So happy to be here today. We're going to share a bit of information about the services we provide, but also if there is an opportunity, we're always welcome feedback on the services and input on community needs as well. So I think I am joined today by Robin Taylor and Heather Hornibrook. Lou Gross, our public information officer, did kind of give them some intros as well. In terms of our role in the community, we are the mental health and substance use disorder plan for Kern County. And what that means is we have the responsibility for those specialty care needs for Medi-Cal and uninsured, and they're really the higher treatment needs. So those with the chronic and persistent mental illness and the substance use disorders. There are other care plans that you may be familiar with, whether that's Kern Family Healthcare, Kaiser, or even Anthem Blue Cross, and they contract with providers in your community and elsewhere in Kern to provide the mild to moderate behavioral health services. So we kind of work alongside them, serving, sometimes crossing over, but a little different in the population that we serve, but close partners with them as well. And then you may have, other providers who accept private insurance in the community too. So our population is those with the higher acuity and the higher needs for the behavioral health care. Within our service system as the plan, we provide about 50% of our services are contracted through contract providers, and the rest of it we provide through our department itself. And services we do contract, a lot of them out in the outlying areas, and in the Fraser Park area, the services are contracted as well. We kind of anticipate this growth in the future towards more contracted services. And so we're always excited to work with different partner agencies that are interested in services and really familiar with the communities that we are responsible for providing great services to. So with the anticipation of the growth, we made some changes internally in our department and assigned a clinical plan services administrator. And that is Heather Hornibrook, who's with us today. So I'm going to switch it over to her, who's going to give a little bit more information and introductions to our service provider for that area of the community as well. So thank you.
Good morning, everyone. Again, my name is Heather Honeybrook, and I'm the administrator over, as Allison mentioned, the clinical plan services division within our department. And this division includes our outpatient contracts, adult and children's for Kern County, which includes your community as well, but it's also within Bakersfield and East Kern, which includes Mojave, Ridgecrest, Lake Isabella, West Delano down to Taft. So you can see all throughout Kern County are the clinics that we contract with. And so as Allison mentioned, we are the mental health plan. So we provide specialty mental health services to our community. And so some of those services that are included are individuals that need assessments, individual group or family therapy. It could be medication support services and psychiatric services, crisis intervention, targeted case management, and so on. And these services are provided in the clinic or in the field. And when I say in the field, it could be, it could be somewhere in the community, in a home, at the school, whatever the needs are, if it's a youth or adult. So it's provided to, this clinic provides services to our children as well as adults. One thing I wanted to do is, I know that the clinic manager is here and she attends this meeting, and her name is Jennifer Williamson. And I feel that it would be helpful for her to speak as well, because she could be able to provide you information about the day-to-day operations of the clinic. Jennifer?
Yes, thank you, Heather. My name is Jennifer Williamson. I'm a licensed marriage and family therapist and the clinic manager here at Clinica Sierra Vista. I'm down here now in Lebec. We moved down here from the Fraser site in December of 22. Confused now that it's 2024. I'm like, what year are we? But we've been down here for a little over a year now. So we're in here within the CHC site together, which has been a tremendous feat, and it's been amazing to be here to provide, mental health services as well as refer to medical if some of our clients haven't seen a doctor in a long time, and vice versa. The medical refers to us for behavioral health services a lot. So it's nice to have that coordination here in one site. So we do serve, as Heather was saying, with the whole mountain community, anywhere from all the way up in Pine Mountain, all the way down here to the Lebec Oaks area. We do go all over the mountain to provide, as Heather was saying, field services, whether it's home. We do service all the schools, even Gorman School here for the kiddos. We do adults and children all in one site here. I think right now, serving the whole community, we have about 47 children and about 125, 130 adults, I want to say. So we do keep quite a bit of a caseload here. I do have one adult therapist, one child therapist, and one case manager and one child case manager. We do service psychiatry for both adults and children as well. And as Heather was saying, crisis services too, to kind of de-escalate situations for clients, prevent hospitalization or perhaps recidivism of hospitalization. We provide therapy services, individual, family, case management, like Heather was saying, so resources for clients. I know we do refer sometimes too to the Family Resource Center there, which we partner with for clients to get some resources sometimes. So like food resources, coping skills, communication resources, pretty much all around just helping, the community and clients with behavioral health needs, whether that be on the very high end of the severe level, all the way down to kind of our more moderate clients. We don't here yet have a step down at the CHC, so we kind of hold those clients at this time that still need medication management and maybe follow-up services just to maintain stability. I know that was a lot, but if anybody has any questions ever at any time, feel free to give me a call here, email me, whatever is best. I'm usually always available.
So we just wanted to see if there's any questions that maybe we can answer, support. I know that also Jennifer has pamphlets and information about the clinic, and if anybody is in need of those, I'm guessing you can send them electronically or deliver them, or whatever needs to be done.
Yeah, definitely. I can send electronically, and I can bring some by to the resource center, so you have those available for anybody who may come by or for yourself to know the resource.
That would be wonderful. Thank you.
Of course.
I do have a question. I know that we had talked a while back about kind of moving toward being able to do some substance use disorder treatment in the mountain communities, rather than having to use the hotline or try to get them, out of the mountains. And I was just wondering where that's at, and what that possibility looks like right now.
I can take that question. Yeah, you're right. There have been some discussions, probably for the last year or two. And so we kind of look at the data and kind of in our design of systems and everything, making sure that the population, and the need is there to support. And it is something that we're revisiting right now. So we haven't made any decisions yet, but we are still working with Clinica and looking at opportunities to do that, because we've heard from community stakeholders that the need is there, the desire is there to add those services in the community, so people are not traveling as far to access substance use disorder. So just so you're all aware, we've heard the feedback, and it is something that we're working towards.
Yes, that's really nice to know. I know that we got a donation of fentanyl testing strips, and when we got that donation, I think he told us that those should last us a couple of years, and we can't believe how many of our clients take them every time they come in. So there is a big use up here, and I know that's one of the barriers to being clean and sober is getting to treatment because of where we're so isolated. So having something like that up here would be amazing for our population, because it affects not just that person, it affects the whole family, the whole community, into the kids and going to school, that kind of thing.
Absolutely.
Any other questions or comments or anything about our first presentation? All right, everybody's quiet this morning. All right.
Okay.
There's
Thank
Claudia.
you. Thank you so much. My name is Claudia Cuba, and I am one of the advocates here at the MCFRC. And our next presenter is Lindsay Call with First Five Kern.
Thanks. Okay, I am going to share my screen. So they asked if I would come on and share a little bit about some things that we're working on at First Five Kern, and something that the Mountain Communities Family Resource Center is involved in and engaged with as well. But I'm really happy to be here because I've missed seeing familiar faces, and yeah, still really miss my team at the MCFRC and just the community. So really glad that they asked me. So one of the things that we just kicked off on Monday, so it's really fresh, is the Kern County Home Visiting Collaborative. And this is focused around early childhood home visiting. Obviously, we're First Five. For those who aren't familiar with First Five Kern, we fund programs that serve children 0 to 5 and their families. And so we're a main funder of the Mountain Communities Family Resource Center and one of the things that we are always most interested in funding is home visiting efforts. So at the MCFRC, we call it the Family Success Coaching, one-on-one support for families with young children. But we're participating in a regional work around this. So throughout San Joaquin Valley, there's 7 counties. You can see the logo right up there. It's pretty small, but it's called Heart of the Valley, and it takes in 7 counties in the San Joaquin Valley that are working together to strengthen home visiting as a key prevention against child abuse and neglect. And so this is kind of an outline of where we're at on the timeline. This is a 2-year project, started with a kickoff last year in Merced, who is the hub for this regional work. And then our Kern County kickoff was on Monday. And Misty was able to be there, and we had representatives from 19 agencies around the county that do home visiting, along with some that are stakeholders in home visiting and maybe don't directly do the home visiting. Like, for example, Department of Human Services contracts out to do some of their home visiting efforts. And so we are just getting going with this. And I'm going to, one of the things that we're working on right now, you can see in June, we're hoping to release an environmental scan / needs assessment to kind of, we're trying to map out what are the home visiting programs that are serving our county, and where are they, and hopefully see, usage information and of how many slots are funded and what kind of need there is versus what kind of capacity there is. So those are, and part of that environmental scan and needs assessment is also going to be some parent surveys from parents who have utilized home visiting services to understand their perceptions, what went well with that, what kind of needs that they needed addressed, and just looking at that. And then kind of the over the next 18 months, we're going to have virtual meetings to highlight program models, and there's going to be some training opportunities for home visiting staff. And then culminating at the end in June 2025, which seems so far away, but we'll be here in a blink. We'll be finalizing a county action plan that will connect with the regional plan to continue supporting home visiting and what that looks like. I'll just go through this briefly, but these are some of the regional activities that are happening. There's regional work groups on specific topics. They're working toward a regional plan. They're going to be conducting a parent caregiver survey throughout the counties. And so that's where we are going to need our partners like the MCFRC to help distribute that to some of the families that have utilized their services. There are 3 regional parent advisory groups because a big part of this, this is an initiative coming down from First Five California. So there's this is happening throughout regions all over the state. And a big piece of it is getting some more parent input into these home visiting programs. Another piece of it is a home visitor needs assessment. So we want to hear from home visitors what their needs are, what they feel like is going well. This is as most of you know, the kind of crisis intervention work can lead to burnout and a lot of challenges around that. And so we want to know how home visitors are doing with that and what would increase their retention and their longevity in this field, which can be difficult and sometimes isolating depending on how many staff you have in a location. And then finally, there's some communities of practice around certain topics that they're going to be convening home visitors to discuss. And all of that data and personal experiences and stories is going to go into informing this regional plan to strengthen home visiting. Those are some of the work groups. First Five Kern is participating in the first 2 related to eligibility, screening, and intake, and trying to think about, streamlining that process. For example, referring if someone doesn't fit in one home visiting program, but they might fit into another, how do we streamline that referral so that we can have a really a better continuum of care throughout the county to help families. And then we're also participating in the fiscal mapping and sustainable funding sources work group. We are, as some of you may know, First Five Kern is funded by cigarette tax money, which that legislation was from Proposition 10 was designed so that the funding would go down over time as people reduced smoking. And that is exactly what's happened. And so the good side is that is a positive thing for public health. The not as good side is that we are funding some really critical services for children and their families and in those very critical early years. And as the funding reduces, it puts at risk some of those programs that we've been funding. So we're really actively looking at what are some other funding streams and how can we braid things together to continue the level of services that we have in Kern County. And then there's a few other groups as well that we're kind of focused on those top 2, but there's also going to be things around the workforce and training and looking at shared outcomes. So I mentioned this already, but this is currently in recruitment for home visiting staff. One of the things that I'm really happy about was that they are compensating both home visitors and parents for participating in these groups. So as a recognition of the fact that it is, they're providing a valuable service and not just being asked to, for free, give their time. So that recruitment is currently underway. And then I already kind of mentioned this, but this is what this looks like in Kern County for our local collaborative. We are charting out 2 in-person meetings per year of this grant period. And we had our first one on Monday. And then we will be having some of those focused on direct service staff. Some of the feedback that we received was that really during the pandemic, a lot of home visitors were trained via Zoom, and that was all of their training. But home visiting, in order to be really good at it, you need some practice in person. And we also think there's a kind of a desire for home visitors, from what we've been hearing, to get together and be able to network and kind of talk about the challenges that they face with other people who are doing that work, because it is kind of a niche filled. And then in the meantime, we'll be having some virtual meetings. We'll be mixing up kind of program highlights from different programs. And I wanted to actually kind of pause there because I know we have some school staff here. And you know me, well, a lot of you know me, I always want to get some like thoughts. And this is a great group that's generated a lot of good thoughts for me. But one of the things that I've been thinking about in this collaborative, some of the feedback that we've received from the home visiting is it's great to be focused on early childhood home visiting, but there's other programs that are doing home visits. And, you know, hearing from people that do other types of home visits might inform what early childhood home visitors are doing. And I know with the community schools, some schools have been using the community schools funds to do a little bit more of that home visiting, usually, as far as I understand, in the context of truancy. But since I know we have a couple of school people here, I was wondering, you know, one of the things that came up was, can we hear more about what schools are doing and see how it fits in with this early childhood home visiting? So I was curious if any of the school-based staff that are here in the meeting would share a little bit about what home visiting does look like in the schools right now with those community schools funds, and what you're doing around home visiting. Or if none of the school staff are able to jump in, I'd love to hear, because I know, Maria, you're also connected with the schools, like what you kind of know about what's happening with home visiting with the school-based.
Hi, my name is Maria. I'm a family bilingual advocate here at the Research Center. Actually, Lindsay, don't quote me on this, but I'm not 100% sure that the school does home visiting with the kids. For the most part, the parents come to the school and that's where we visit and they talk to them.
Okay.
But I think that would be a question more for Corey. I don't know if she's there, for Katie.
Yeah. Well, they might have had to step away, which is totally fine. From some of the early feedback that I've gotten, some of the participants in the home visiting collaborative wanted to hear more from schools. So I'm trying to figure out, you know, is that something that they're doing and what does that look like? Misty, did you have something you were gonna kind of jump in?
No, I was just gonna say if they've had to step away due to students or a staffing, Corey had told me at the beginning that they have a lot of people out sick. So their front office staff is a little under. Oh, there's Corey.
Sorry, I couldn't find where my stupid bottom toolbar was.
No worries.
It's okay.
Okay, what were you asking me, Lindsay?
Yeah, I was just wondering, because one of the feedback that I've gotten in this home visiting collaborative early on is that these early childhood home visitors want to hear more about whether home visiting is happening with the schools, through the community schools, through kind of truancy prevention or things like that. And I didn't know if you guys are doing home visits or what that looks like. And I was interested to hear.
Our site does home visits for 3 different reasons. The majority are attendance, but actually this year we've been pretty lucky. Last year we had to do it a lot. This year it's really only been, we do home visits to pick kids up when they miss the bus. Here, transportation's a huge issue. You miss a bus, you're out of luck. So we do like a second round in our from here when somebody calls. The kids all know to call. So, but you know, we're junior high, so they're gonna call and say like, I missed the bus, I don't want to get in trouble. So we do that. We do home visits with parents when there's like it's something immediate that needs to be addressed, usually mental health wise. And then our community school grant, we are just in the planning stage still. So it is written into our implementation grant to do home visits. We also have like that one site vision clinic coming up. So for that, we had some visits to the homes just to get them to sign the document so that their kid could get their glasses.
All right. Well, thank you. Yeah, that's that's just one of the things that these early childhood are interested in hearing, because they're not embedded in the schools and wanted to know more about like how that's going, or if home visits are going to become more of a practice. But it sounds like when there's an issue, that's when you'd initiate home visiting.
And then as part of all of the beginning, like surveys, a lot of them we did interviews with because parents wouldn't complete it, but we felt like that pocket of area. So we have kids program. It shows us like little demographic information. We wanted to make sure everybody was represented. So we did some for that too.
Yeah. Well, great. Well, thank you. I always know this group will give me some good insight, so I appreciate it. Okay, so I'm going to jump back in and just have a little bit more that I wanted to share about. I already kind of shared about the environmental scan and the Kern County action plan that we're going to be working toward. This is just kind of to give you a little bit, I've shared a little bit about this. Our meetings, we're going to have a mix of in-person and virtual. And then we've designed it so that there will be some that are focused around kind of leadership and supervisors of home visiting programs, some direct service staff, and then a combined focus where as some program highlights that might interest both direct service staff to think about what kind of practices they could put into place, as well as supervisors and knowing more about program design. And so that's what our local collaborative looks like. And I wanted to share, on that timeline, you may have seen something that said FEDM training. And I wanted to share a little bit about that, a project that First 5 Kern is also just beginning. And it's sponsored by Kern Health Systems, which better known as Kern Family Healthcare. So family engaged developmental monitoring is kind of a big term, but it's something that is already familiar to Family Resource Center staff. It's related to screening and engaging families in developmental screening to make sure that kids are receiving the support and services that they need. In last year, as part of our First 5 Kern's strategic planning process, we engaged in some research to look at some key indicators around child well-being. And one of the things that really stood out to us was this graph. And so you can see that basically, according to Medi-Cal data, this comes through Kern Health Systems, since they are the managed care provider for most of the children on Medi-Cal in Kern County, that only 1 in 20 children on Medi-Cal was receiving a developmental screening in their first 3 years of life through their medical provider. And you can see that's a stark contrast between the percentage that is receiving that throughout the state. So 28% versus around 4.5%. And so we saw this and we thought, this is kind of a big red flag. What can we do to work on this project or this problem and try to, move the needle on that percentage of screenings? And so we designed a project that is going to entail 3 different parts. The first is community partner training on this family engaged developmental monitoring. And that's something that we're going to do through the Home Visiting Collaborative, as well as through some of our early learning partners like daycare, preschool based programs. And so in that, we're going to have an opportunity for both supervisors and leadership to be trained on family engaged developmental monitoring, as well as an in-person training for staff, direct service staff and home visitors. Another piece of it is we're going to do some research. So we're going to try to figure out a little bit more about why that number's so low. That number, that 4.5%, is based on medical provider billing. And we really want, when pediatricians are seeing kids 0 through 3 years old, we really want them to be doing more developmental screenings. And I'll get in a second to the research on why that's so important. But we also want to survey some parents and understand, their perceptions around this. And then finally, informed by that research, we're going to be doing medical provider outreach and training in the second half of the grant period to hopefully, again, move that needle so that more medical providers are doing developmental screenings and are understanding how to engage families in that process. And so for those who aren't as familiar with this, this terminology, a developmental screening is something that happens basically one point in time, uses a brief validated tool. One of the most common in Kern County is the ASQ3. That's what the MCFRC staff do in their home visits. But a very related term that's used in the medical field is called developmental surveillance. And again, one of the things that research has suggested is that this term surveillance, which is more common in the medical field, is really not something that families feel very comfortable with, which probably most of us, for obvious reasons, can understand why developmental surveillance sounds kind of daunting. But it's a provider strategy to get family opinion and concerns in order to monitor the child's development. And so developmental monitoring is a term that is being used that is hopefully kind of a middle ground. It involves something that hopefully parents will be more comfortable with, but still uses validated screening tools along with informal dialogue with parents. And the important piece of it too is re-screening at set intervals. A developmental screening at one point in time can be helpful for certain things. It can certainly identify certain things, but over time is where the real power comes in to know if a child is developing on track, because there is such a range of, we want to look at whether the child is growing in certain skills over time, not just at one point in time can they do these skills. And so, as I said, the research is still in its infancy in some aspects of family engaged developmental monitoring, but some findings are already pretty powerful. And so some of this is also based on kind of the theory around why this is so important. But one of the key studies that I've been looking at that's been done over the last 3 or 4 years, they've seen that using family engaged developmental monitoring not only increases the chances that developmental delays will be identified, but also that families will actually access services. And that often comes because of that dialogue that's happening. Parents become more knowledgeable about the developmental milestones. They're more equipped with tools to foster an enriching environment. So for example, when parents do an ASQ3 or they see some of the skills that an ASQ3 is trying to tap into, they might not have even realized that that particular skill is a developmental skill that we want to foster in a child. And so by doing this screening process and having dialogue around it, they start to realize, oh, if I provide this tool, that will help my child develop fine motor skills or their gross motor skills or their problem-solving abilities. Also, it leads to greater awareness of risk factors and how their protective factors can offset those. They become more skilled in identifying potential delays in their children, more knowledgeable about resource options for them. And also one of the big goals is just developing a greater ability for a parent to advocate for services. So for me, I hope that this project that we're going to be working on for the next 2 years, at the end of it, we have parents who feel more confident when they go into their medical provider to say, hey, I would like you to do a screening on my child. Whether or not they think the child has delays, that it's just a good practice to request screenings and get that information and know where they can work on different skills with their children. So we will be doing, as I mentioned, some over the next few months, March, May, and September, we'll be doing some community partner trainings around family engaged developmental monitoring. And so it's something that I hope the MCFRC staff will be able to participate in. And some of that, there's also a self-assessment reflection tool for home visitors and programs to think about how are they aligned with this family engaged approach already? Do the families, are the families growing in the process of these conversations and screenings? Because it's not just about screening the child, it's about engaging the parent in that conversation so that the parent feels like they're gaining in knowledge and advocacy. So the other question that I wanted to ask with the behavioral health teams that some of them are here, because I've been in touch with a lot of the county agencies, public health that does some home visiting, and DHS and who they fund in home visiting. And I was just curious because I haven't been in touch with behavioral health and recovery services, if there's any home visiting that your agency sponsors, or any stakeholders in that you think would be helpful for me to engage in this home visiting collaborative.
Just wondering, Jennifer, is there anything that you're aware of through your clinic?
Just what we offer for our clients, like the home visits, school visits that we do. That's about all for here as far as like home visiting for kids and adults both. I'm not sure what other resources there are here, but that's what we offer for at least the clients that we have, definitely to reduce those barriers to treatment.
Yeah, I know you had mentioned that to me before, for people especially who are in isolation or really struggle with. So yeah.
Oh, definitely.
Great, thanks. Yeah, I'm as we start this environmental scan, I'm just asking everyone, trying to figure out, am I missing any key pieces? Is there any programs that we're not aware of yet that we need to engage? So I appreciate that. Well, that's all that I had prepared, but I'm happy to field any questions that anyone has, and thank you for letting me share about what I've been working on since I left you all.
Thank you, Lindsay. I have a question. Could you tell us a little bit more about how the parent advisory group works, and if there's still time to let some parents know?
Yes, so the parent advisory groups, the way that they're doing this regional work is they are having only a certain number from each county, the exact same number, because they want it to be really balanced throughout the county so that the regional work is informed by every county, and no county has an outweighted voice. And so there is time. The flyer, I know I sent it, Missy brought it home after the kickoff meeting. And
yes,
parents.
I do have that.
Oh, sorry. What was that?
I'm sorry. Yeah, I have the flyer.
Okay.
I think.
So yeah, and they are accepting applications for that until February 2nd. And they anticipate that there's probably going to be more interest than there will be slots, but they also are going to have a waiting list. So that, because, obviously things change with families, you think that you're going to be able to participate, and they're really looking for this, this is probably going to be like a year-long process. So there will be times when they'll have to bring in a new parent to kind of fill a slot. So yeah, I absolutely would encourage to talk with any parents that you feel like would be able to offer some perspective and have engaged in services like home visiting to get them either registered, they may be selected in the first round or be on the waiting list. Because yeah, of course I want Kern County to be heard, and as well as like a variety of voices around Kern County, not just, based from one program that's out of Bakersfield or something like that. So yeah, definitely, if there's parents, there's still time until February 2nd to, and there is a QR code to do the application. But you can always walk a parent through it and kind of help them in that process if they need any help with that.
Thank you so much. Okay, that sounds good.
Yeah, thank you.
Thank you, Lindsay. Any other questions for Lindsay about the home group collaborative or anything that they've got going there at First Five? No, okay then. Let's jump into, I want to make sure, and I know that some other people are having trouble getting on for today. I'm not exactly sure why Zoom is doing this, but our collaborative is changing, so we will be meeting every other month. So our next meeting won't be until March. I'll send out an email with a new link. I'll try to reset it up, see what's going on there. But just so you guys know, so instead of meeting 8 times a year, our collaborative is only going to meet 6 times, and it'll be on the odd months. So we are looking for host organizations who would like to host our in-person meetings that are in May and September. So if anybody would like to host that and you're in the mountain communities, please let us know. You don't have to tell us now. You can send us an email, no pressure. So something to think about if you would like to actually host one of those in-person collaboratives. We at the Resource Center will probably host one of those, depending on if there's other organizations, because we are redoing downstairs. We've got a funder that has given us money to rent a new space for our children's circle and to be able to have space. The church was letting us use their meeting space, but it's really not set up for children. So we've got this new space that we're doing, and we're very excited. I believe our program director actually is down there working on it right now. We're trying to launch it as quickly as possible. So she's very excited about that. So we'll be hosting one, but if anybody would like to host, please let us know. Very excited, like I said. And Lindsay, to go back with what you're saying, I am really excited about the home collaborative stuff and trying to get not just that part, but trying to get more ASQs and more things like that done with the early development screening. One of my advocates, Maria, who spoke earlier, she and I will be starting a program, and it's called the Parent Project Help Me Grow, and we're going to be really focused on getting parents to do those ASQs with their kids, and then getting the follow-up medical care and getting the dental and vision care that they need. So we're going to be very focused on that, and that actual wonderful grant comes through Kern Family Health as well, because that is really their focus, and we're grateful to be partnering with both them and First Five with all of that. Do any of our partners that are on today, do you guys have anything going on from your sites or that you'd like to share with the collaborative? Anything coming up that you want to share with everybody?
Misty, we have a meeting coming up for parents, a training that Maria, we're doing together. It's on January 30th. And so I just wanted to let everybody know it's a budgeting thing for parents, and we made flyers and sent them out with the kids. So I'm hoping that we get a good turnout there. That's one of the things during our community schools that the parents actually ask for. So hopefully.
So that's this coming Tuesday at 10 a.m. here at our office at the MCFRC. So if you guys know anybody with children 0 to 17 that are looking for budgeting, or as you come across clients, please share that with them. Again, and Maria is going to be teaching that budgeting and really talking about, where's your penny going? Do you know where all of your dollars are going? Because so many times that's the biggest obstacle for so many people when it comes to budgeting is they don't have an actual written budget, so they don't know where their money's going. So anybody else have anything that your agency is doing that you would like to share? It's quiet today. Everybody is just yelling. I understand. We're all just now getting into this new year.
Feels like a Monday.
Yes, it does. Okay, then yes. So the MCFRC has that upcoming with in conjunction with the school, which is the Tuesday. Then next Thursday we have our coffee chat. So if you have parents on the mountain or clients that have children in school or even younger, our 0 to 5s, they're more than welcome to come to our coffee chat, which is next Thursday. Jessica, what time is that? Is that at 10? Wait.
Let me check. Hold on, I gotta find my calendar.
We've kind of changed it around, so that's why I'm like, I don't remember what time we meet right now.
Next Thursday at 10. Yes.
Okay, so we're doing coffee chat at 10 a.m. and we usually provide coffee and donuts, that kind of thing. And with our meeting space downstairs, we're hoping after the bad weather, we're actually going to be launching a seniors and adult coffee chat once a month to bring in our seniors, because there are so many here that are, you know, isolated from family and friends all day and they don't really have that connection. I think that's it, unless any of the advocates know of something I don't remember. Except our children's circle every Wednesday. I think that's what we've got going right now, but we're so excited for this new year, excited to hear from all of our partners. If you haven't presented for us, or if you have a new thing you'd like to present, you can send me an email, or you can send one to Claudia. Her email is ccuba, so there's 2 C's, it's ccuba4303@gmail.com, and she's doing all of our scheduling for the year for our collaborative, so she's amazing. So if you guys if you'd like to present, or if you would like to host, you can reach out to either one of us. And I just want to thank you guys for joining us for the first meeting of 2024 as we work out all these new bugs. So thank you so much, and you guys have a great day.